Iowa.
I grew up in Canada. Okay, we have socialized medicine, and I'm here to tell you that this bullshit line that you get on all of the political shows from people is that it's a failure. The system is a failure in Canada. It is not a failure in Canada. I never waited for anything in my life. I chose my own doctors. My mother never paid for a prescription. It was fantastic. And I just got back from Vancouver, and I keep hearing this, like, Canadians are so nice. Canadians are so nice. They can be nice because they have health care. Because they have a government that cares about them. That doesn't say sink or fucking swim, pal.
Right.
Or you live in a box.
Yeah.
There are certain people in our society that need to be taken care of. There are people without as many opportunities that need to be helped toward those opportunities. There are people who are sick.
But that's the...
You shouldn't have to lose your home because your mother got sick.
And look,
U.S. versus Canada healthcare. Which one would you choose?
Canadian healthcare.
Is there a reason?
Yeah, it's free. It's like, it's funny because like my American friends don't get it. They hear the horror stories.
Yeah.
And there are some bad things about, look, if I had unlimited money, maybe the American one's pretty good, but then that kind of defeats the purpose.
That's right.
I love being able to walk in with a card. It doesn't matter if I have a sniffle or a gunshot wound.
Right.
One card, will you fix me? And they're like, yes, come in.
Sure. You might wait.
You might wait.
You might wait.
You know what? I've been in emergency rooms in LA. They weren't fast.
Oh.
I wasn't sitting there going, wow, this is the fastest.
And then, you get 3 bills in the mail.
Oh my gosh.
And it's terrifying.
Oh, the best is when they send you the bill and it's not for you. It's just what the insurance company owes. It kind of looks like it's for you. You're like,
what? This is for me?
and they're like, no, we just want to let you know.
And God forbid you go to the wrong out-of-network, whatever the hell that is.
I don't even get that. What is a network?
Canada, 1-0.
I just came back from an ultrasound. Canada's healthcare system is incredible. Walked in there with a form that my doctor gave me. The woman told me to sit down. I sat down and within 2 minutes, she was, okay, we're ready for you. I was like, what? And I had 2 letters, one for my stomach and one for my neck. The whole process, 2 ultrasounds took me around about 30 minutes. You think you're going to get an ultrasound in 30 minutes in the UK? Are you insane? Firstly, there isn't even a walk-in centre like that. You'd have to wait for an appointment. And that appointment's going to take weeks. Never mind just walking in and then just getting seen within 10 minutes. And I didn't even pay for it. Okay, it came out my taxes and whatever else. But I just left that image centre feeling more confident about the issues I've got than I ever did when I was in the UK. And that is a testament to the healthcare in this country.
So my wife and I just got a letter from United Healthcare telling us that they're denying coverage for our twins stay in the NICU. And if you thought that was inhumane, you're right. But listen to this. They didn't address it to me or my wife, like human adults. They addressed the letter to the baby. Sadly, I guess it is appropriate that our preemie baby's first experience in the world is having its healthcare coverage denied. I guess my only other question for United Healthcare is that if the baby was still in the womb, would you have sent the letter to my wife and had her eat it in order to get it to the baby?
You do not get free healthcare. You do not get free healthcare.
Do you know how much it costs to have a baby in America? Depending on your insurance, 6, 8, 10, 12, sometimes $15,000. No insurance can be $30,000, $50,000 if you have a C-section. Do you know how much it is in Canada? Free! You walk in the hospital, have the baby, and you walk out of the hospital, and you just get in your car and you go home. Cheaper than a cup of coffee.
79% of Americans are dissatisfied with the cost of healthcare. Because unlike Europe, we have to pay for our healthcare here, and it's like thousands of dollars for simple surgeries.
Here is your bill for $10,000. No, that can't be right. It should only be...
Versus in Canada, where I've had 3 hospital births in the last 6 years. This will be my 4th. And all I had to pay was $7 for parking.
For many Americans, the idea that a patient can walk into a hospital, receive all the necessary treatment, and leave without facing an enormous bill may sound almost impossible. In Canada, most essential medical services provided in hospitals and clinics are publicly funded through each province's health insurance plan. Canadians do, of course, pay taxes to support the system, but in most cases, patients do not have to pay large amounts directly for insured services. This often surprises many Americans who are accustomed to navigating insurance policies, deductibles, co-payments, provider networks, and unexpected medical bills. Supporters of the Canadian model argue that healthcare should be treated as an essential public service rather than a benefit dependent on a person's employment, income, or financial means. They often point to families who do not have to live in fear of bankruptcy because of emergency surgery or a cancer diagnosis. For many Canadians, the peace of mind that comes from knowing they can access necessary care, regardless of how much money they have in their bank account, is one of the system's greatest strengths. Critics, including many conservative voices in the United States, argue that the model is not without costs or trade-offs. They frequently point to lengthy wait times for certain non-urgent surgeries, specialist appointments, and scheduled procedures. From this perspective, describing healthcare in Canada as free can be misleading, since the system is still funded through taxation, and demand for care can sometimes exceed the available supply of healthcare professionals, hospital beds, and medical equipment. This is precisely what makes the debate between the two models so contentious. Some commentators view Canada as proof that universal healthcare can operate effectively. Others argue that Canada's challenges demonstrate why governments should not become too deeply involved in healthcare. As usual, however, the reality is far more complicated than simple political slogans suggest. For decades, Canada's system has ensured broad access to essential medical care. Even so, the country continues to face challenges, such as long wait times, shortages of doctors and nurses, pressure on hospitals, and rising demand from an aging population. By contrast, the United States remains a global leader in many areas of medical research, technology, and innovation. Many patients with strong insurance coverage may also be able to access specialists and treatments more quickly. However, millions of Americans continue to worry about costs, insurance coverage, and the risk of taking on significant medical debt. For that reason, this discussion is not only about hospitals or how medical bills are paid. It also reflects deeper differences over the role of government in people's lives. Many American conservatives prioritize lower taxes, competition among private businesses, and an individual's freedom to choose doctors, hospitals, or insurance plans. In Canada, voters across different political parties generally continue to support maintaining universal health care, although many also acknowledge that the system needs reform to operate more quickly and efficiently. The debate, therefore, is ultimately about more than doctors, patients, or emergency rooms. It also represents two different approaches to governing a country. The comparisons that have recently spread widely across social media have only made the discussion more intense. Videos showing Canadians explaining that they have never received a hospital bill after treatment often attract millions of views in the United States. Beneath such videos are thousands of comments from Americans asking why their own healthcare experiences are so different. Some express admiration for the Canadian model. Others remain skeptical and argue that faster treatment, a wider choice of hospitals, or easier access to specialists may justify the higher costs. However, these discussions rarely remain calm for long. Politicians on both sides of the border often help shape how the public understands the issue. Donald Trump has long emphasized market-based solutions, greater competition, and a more limited role for government in many areas, including healthcare. Meanwhile, Canadian leaders have generally continued to defend universal healthcare as an important part of the country's national identity and institutions. Most healthcare debates in Canada are not focused on whether the system should be abolished, but rather on how it can be modernized, expanded, and strengthened. As a result, whenever political relations between the two countries become a major media topic, healthcare is often quickly raised as a point of comparison. For most ordinary people, however, the issue does not necessarily need to be framed in heavily ideological terms. What they want is fairly simple: access to high-quality, reliable, and timely medical care without facing overwhelming financial pressure or unnecessarily long waits. Whether someone supports a private system, a publicly funded system, or a combination of the two, the ultimate objective is essentially the same. It is to ensure that patients receive appropriate, effective, and timely care when they need it most. Perhaps the clearest lesson from the ongoing debate is that no healthcare system is absolutely perfect. Canada provides access to necessary medical services for its entire population, but it must continue finding ways to reduce wait times, recruit more healthcare workers, and expand hospital capacity. The United States, meanwhile, remains a world leader in medical research, healthcare technology, and many advanced treatments, but it has yet to fully resolve the challenges of affordability and insurance coverage. Rather than viewing this as a contest in which only one country can win, many policy experts argue that Canada and the United States can learn from one another. Each system has strengths worth recognizing, as well as limitations that should be acknowledged honestly. A truly productive debate should perhaps focus less on proving which model is superior, and more on identifying solutions that can help people in both countries receive better care.